Democrats are divided and waiting to hear specifics about what the president wants in a final health care plan. And Democratic strategist Michael Feldman, also Republican strategist Kevin Madden joins us now to talk about this changing climate for the president. Let's talk, guys, first of all, about what Eric Cantor had to say today. He, of course, the Republican congressman, head of the Republican caucus, who talked about what Republicans want to see.
For us as Republicans in the House is an opportunity, hopefully, for us to see our president willing to start to focus on areas that we can agree on and not just focus on the areas that divide us. We all understand we can rally around solutions having to do with pre-existing conditions. We can do things about making sure that if somebody loses their job, they don't necessarily lose their health care. Instead of trying to insist that government replacement or government competition is all that we should be about.
Mike Feldman, that is basically what Orrin Hatch also wrote to the president about today. Let's go for what we can obtain in a bipartisan way, incrementally. Is that ever going to fly with the House Democratic caucus?
Well, I think it might. First of all, Representative Cantor is right in one respect. I think in the president's plan you'll see Republican proposals and you'll see Democratic proposals. And not everything in the president's plan is going to become law, but a large chunk of it may. And the fact is there is a large swath of agreement on most of the plan. Real health care reform that we haven't seen in 3 decades. We're right on the verge of getting it. And so I think if some Republicans can put aside the need to have an issue instead of health care reform, we may actually get a bill and Americans may get what they voted on in November.
Kevin Madden, are we going to have rare agreement here today?
Well, I think it would be a departure if the president were to reach out from Republicans, because up until this point, he has only focused on criticizing Republicans and painting them as an obstacle to reform, when in fact Republicans have been at the table and insisting upon some sort of bipartisan solution to many of the health care reform issues that are out there today. So if the president really wants to reach out to Republicans, he's going to have to talk about the issues that are most important to us, namely cost. This is $1 trillion over 10 years, which is too much at a time of massive spending in Washington, and competition, which makes sure that we don't crowd out private industry when it comes to this reform bill, and that we don't drive costs up in the process.
By the way, roll call, Mike Feldman points out that in the president's first speech to Congress, the joint session of Congress last February, he devoted only 174 words of 6,400 words, 6,427 words to health care. Did he miss the boat in not getting more specific and laying something more out?
No, look, I don't think so. I think you heard the president this morning on an interview saying that there was a little bit of a vacuum created over the summer. A lot of noise and a lot of misinformation developed over the summer. So tonight, essentially, he gets the biggest stage that a president has. He has a joint meeting of Congress to explain directly to the American people what health care reform means to him and show us the way to get there. I think it's pretty clear. If you have health insurance, his plan offers a stability and security to keep it. If you don't have it, it offers an affordable path to get there. And don't forget, Andrea, the costs of health care, which have gone up, which have doubled in the last decade, threaten to do so again if we don't act. So that cost that Kevin's pointing to is actually very important. What are the costs if we don't act? And I think that's what the president's going to be asking the American people tonight.
Oh, the talking points. Kevin Madden, what about Sarah Palin going back to the whole death panel issue in her comments, new comments about the death panel, which has been completely discredited, and trying to use Eugene Robinson, our pal, our colleague, the Pulitzer Prize winner, who did point out that people could rightly assume that there would be some cost cutting along the end-of-life care. But then in the very next sentence, which he doesn't point out, he slammed her for referring to death panels. Well, look, how did she get away with that?
I am not in the business of defending anybody's position on whether or not there are death panels in this particular bill. I think that that's emblematic of the fact that when you have a debate that is as divisive as this one, that's as important to many Americans, you're going to see rhetorical extremes. Somewhere in the middle of those rhetorical extremes is a very important debate on things like comparable effectiveness wellness and end-of-life counseling. But I don't think, Andrea, that that's exactly what's driving this debate. Going back to what Michael said, I think we're in agreement. Costs are what's driving this debate. At the end of the day, the President and the Congress have to convince the American public that what they're proposing up on Capitol Hill is going to bring down health care costs. Up until this point, Democrats have not done that. That's why you've seen the President's approval rating go down 25 points. He has yet to convince the American public that he's controlling costs with their proposals.
Nicely done, Kevin Madden. Running away from Sarah Palin without ever mentioning her name. Like that. Thank you, Kevin Madden.